Welcome. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber, and I want to thank you for attending this week's retail industry session. This will be the last week that retail is held on Thursdays. We will be combining it with personal services and limited healthcare on Tuesdays starting next week. You'll get that information later in the presentation and also in an email from me, but I just wanted you to know. I want to thank you for taking this opportunity to get updated information, ask your questions, and provide feedback. It's important that all businesses are opening in a safe fashion. We do get complaints, whether it's at the chambers or at Boulder County Public Health, from employees and customers who are worried when a company doesn't open in a safe fashion. For the benefit of our entire economy, it's important that we continue to follow these guidelines and these requirements so that we can build customer and employee confidence. If you have questions today, please put them in the Q&A feature and I'll ask them on your behalf. Or if you'd really like to raise your hand, I should be able to manage that with today's numbers. At this time, I'm going to hand it off to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. And thank you everyone for attending today. So we're just going to jump right in. Today, we're going to be talking about updates to the Safer at Home public health order, resources to support you, and then we'll get to Q&A. It's important to note that the public health order is obligatory. Compliance with it is obligatory. The guidelines come from the state. Those are what we all follow. The requirements frequently change. This is the public health order revision that recently came out is the 5th of the Safer at Home order that came out at the end of April, beginning of May. The timeline. So just quickly, June 1st, Safer at Home was extended for another 30 days. On that same day, short-term rentals were permitted throughout the state. On the 3rd, the state accepted feedback on specific issues, but also they are still continuing to take comments and questions on their main page. So definitely keep an eye out for that. And then today, those the changes that were either proposed before that or feedback they received on the 3rd, CDPHE is releasing the updated changes in response to that. The longer term outlook, Safer at Home is going to be with us for a while. It's not going to go away at the end of June. It's not going to go away at the end of summer. It's going to be with us, but it's going to change, and it's going to be our sort of guiding principle, likely until there's a vaccine or some pretty successful treatment. It will be months before we're back to some form of normal. And that's because COVID-19 is still just as contagious. It's just as dangerous as it was in January, February, March, April, and May. And the best thing we can all do for the population is to stay at home as much as possible. And when you're out and about, wear a face covering. There are a bunch of different sayings. This one is, when in doubt, bring it out. It is very hard to know whether you're going to be able to maintain 6 feet of distance as you go about your daily routines, as you work in your business, as your customers work in your business. That's why we are requiring the face coverings, because it is much easier to just assume that 6 foot distance is going to be violated at times. Okay, go ahead, sorry. Thanks, Angel.
Great, thank you, Jesse. This is Angel Bond. I'm one of the retail liaisons, and thank you, Corinne, for the introduction and allowing us this opportunity to talk. So I wanted to build a little bit on what Jesse was saying about the masks. So I understand that there are some new people on this webinar, and I will get a little bit more into some of the retail specific items. The reason why I wanted to bring up the civil rights mask guidance is because it not only pertains to your employees and what is required as an employer regarding mask guidance, it also talks about members of the public coming into your establishment. So we have received a few complaints over the past couple weeks about people, more and more people refusing to wear a mask, and there was a lack of clarity what businesses had to do and if they could have a blanket order saying that nobody wearing a mask could come in, or if you weren't wearing a mask, you couldn't come into your establishment. So I wanted to link to this, to the civil rights mask guidance. What we're looking at is when people have a medical condition that prohibits them from wearing a mask. And what this guidance letter from Governor Polis had said is that businesses need to make reasonable efforts to grant access to all customers and services to all customers. One thing that I do want to point out is it looks like in this letter that offering curbside delivery or pickup for people who are not able to wear masks is a suitable accommodation. So I will go ahead and just link to this order here, or I will show you where it's on our website. So we've had a couple changes to our website. So you'll notice that probably if you tried to get there how you typically did before. Right, we're going to move this civil rights mask guidance underneath the wearing masks, masks and cloth facial coverings. We'll add it there, but currently it's under the employees section. So down, let me find out where that was. So right here, the rights and responsibilities in the workplace. Currently that letter is located here under employee protections under COVID-19, but we are going to place it in the second location. So when you click on that, you'll get the actual official letter that comes from the governor, and it has the findings, and then it talks about guidance for employers. What you're going to want to look at as as a retail establishment is guidance for places of public accommodation. So down here, they do talk about how do you accommodate somebody with a disability that prohibits them from wearing that mask. So they provide some guidance down here. So I just wanted to point that out, that I know that Corinne had sent it out to you all in the email previously if you were already registered. But I know that we have been receiving some more complaints about people not wanting to wear masks going into businesses. And one thing that I would like to highlight here is try to focus on the messaging of it helps other people feel comfortable coming into your store, because I think that social responsibility, and I know that a lot of retailers are concerned with the optics of people being in your establishment without a mask and fearing that that's going to influence how many people want to come out and shop. So I think using that messaging instead of escalating the situation really is important. Additionally, what we've been getting questions about more and more is what about outdoor retail? So currently, Boulder County Public Health does have curbside delivery guidance. And I just wanted to point out that we don't have fleshed out guidance on outdoor retail. I know that as restaurants are able to move outside, that there's going to be, that retailers are going to want to be outside as well. I spoke with our farmers market liaison and just tried to figure out like how difficult it is to have an outdoor permanent shopping area. And it seems like it is a lot more difficult than what you would think at first glance. So we will be working with the municipalities to talk about this, but the biggest thing is that it's probably going to take a lot of right-of-way analysis, which is the responsibility of your local municipality. So if you're in Boulder, that would be a right-of-way decision that the city of Boulder would need to set up, or the city of Superior, wherever you're at. Just keeping in mind that with the farmers markets, what we've seen is that there has to be designated queuing areas for people paying, and then designated queuing areas for people to purchase the items. And that requires a lot more space when everybody has to social distance within those areas. So since there's so much variability about the right-of-way, I do think that we're going to have to talk to the municipalities about what analyses need to go into deciding whether the local municipalities are going to allow outdoor retail or not. But in the meantime, curbside delivery guidance, we've fleshed that out pretty well, and that doesn't require right-of-way approval. So on the Boulder County Public Health website, there is the curbside delivery guidance, and I will show you where that is later on. Additionally, another common issue that we have with retail establishments is the capacity. So the guidance under Safer at Home and now the current 5th order talks about 50% capacity of retail establishments or what it takes to keep people 6 feet apart. So in some cases, you might have to be at 30 or 40% capacity in order to ensure that everybody can remain 6 feet apart from each other. We have updated our social distancing calculator, which is also available on our website, and I'll show you where that's at here soon. But previously we were talking about how everybody should have 6 feet on each side of them. But this particular calculator does not work because if any one of these people wants to move, you can't do it without violating that 6-foot social distancing. So our updated guidance is basically having a 12-foot grid so that somebody can walk in between 2 people because there's 12 feet in between these 2 people, and so they can safely maintain that social distancing. So I will show you where the social distancing calculator is on our website. I know that can be challenging with a lot of smaller establishments, but also consider possibly some operational changes that you might be able to make, like staggering, like basically setting up individualized shopping hours or appointments so that people can come and look at some of the items so that you can stagger how many people are in your establishment. Last week I talked a little bit about how one of the bike shops, Community Cycles, was having people queue up outside of their store, maintaining 6-foot distance between each of the clients or each of the customers. And then when it was everybody's turn, they would talk to the employee and ask them what their measurements were, ask them what kind of bike they were looking for. And then the employees would bring those bikes out to the parking lot and allow people to test drive those bikes out there, and then do all of the standard disinfection once those bikes were not being used anymore. So just think outside of the box as far as like how you can deliver your services or how you can deliver by appointment, perhaps, if you have a super small store and this 12-foot grid is really limiting. So again, I want to show you where everything is on the Boulder County guidance tools. We have a ton of tools. Some of them have been updated and changed, so we're removing them. As Jesse had mentioned, this is the 5th iteration of the public health order. So there have been a lot of changes, and I know that sometimes that does lead to some confusion. So I will go ahead and go to this boco.org/COVID-19 business. And I wanted to show you all that it has changed where that actually pops up. So right now that's linked to how we used to have it set up, but I want you to look right here under guidance for public health orders, and we have a tab, a link right here for businesses. So on that businesses page, we try to keep this as current as possible. The one good thing is that Safer at Home website, that they're getting much better at providing specific guidance to each retail sector. So a lot of that locally developed guidance that we did when there was lack of clarity for different industries, that has become somewhat obsolete because of the state maintaining a good website. So just generally speaking, I wanted to point out the cleaning and PPE. Here we have some ADA guidance for your employees. We also have that wearing a mask, facial covering guidance, which this is something that you should have your employees look at. One thing that is of interest to a lot of retailers is cleaning and quarantining retail products. So the Safer at Home order talks about how retail establishments should adopt policies that restrict or they can adopt policies to restrict returns. This is going to be something that you're going to have to look at depending on what types of items you're selling and if they are easily cleaned. In the example that I gave with the bike shop, when people try out those bikes, you can easily disinfect and clean those bikes. But with things that are a little bit softer, you know, like clothing or tennis shoes or something along those lines, you're going to want to look at this cleaning and quarantine retail products, because in the cases where you cannot disinfect or clean those products, then we would ask for you to set those aside for 7 days so that they can be quarantined. And one thing to keep in mind is we provide pretty detailed guidance on this. There's a lot of, I know a lot of, at least at the beginning, a lot of retailers were asking us about UV disinfectant systems or steaming their clothes or something like that. We've looked into that, our safety professionals have looked into that, and those are very expensive and they're difficult to uniformly and consistently administer to kill the virus. We're still learning a lot in this, but really the cheapest and the easiest way is for you to quarantine those retail items after a client or after a customer has touched them, quarantine those for 7 days. The one thing to keep in mind is that you should have maybe a pile of things that were on day one and then start a new pile that's not touching the first pile for day two. I know that Corinne has talked a couple times about hanging up clothes that have been tried on in an unused fitting room. So that's also something that you can do. Going down on this list, there's a lot of stuff that doesn't necessarily pertain to retailers, but I would like to point out, here's that employee protections under COVID-19 that addresses the mask order. These are the checklists that we have created. The retail checklist is down here. And then also we've linked to a lot of the posters that the Chamber of Commerce has created for you all as resources. And then we will put the sample mask covering script is something that retailers can have their employees go through prior to interacting with the public, just to prepare them with how to deal with people when they come in without a face mask, or they want to come in without a face mask. And as I had mentioned, we will put that civil rights guidance right under here when we post it. So also we have the videos for the past sessions. So we do take a little bit deeper dive into retail in those previous sessions, just for your reference. Additionally, CDPHE has the retail guidance, and this is what we had initially based our checklist off of. So this provides guidance for any new retailers that maybe are just now opening up. I know that we do have a few new people on the call here, so I don't know if you just weren't open for business, and that would be a good question for the new people. Were you just not open for business, or do you have additional questions now at this point? But this is going to be whenever they update, which in this last update, we did not have any changes really to retail. There was one that pertained to retail where they changed the term from vulnerable populations to anybody who is at high risk for COVID. But other than that, there weren't really any changes to our section. Additionally, the spoco.org is the site that I showed you previously. I do want to touch a little bit on outbreaks. This is for all businesses, not just retailers. But if a business has more than, has 2 people who have either been suspected of having COVID-19 or have been confirmed within a 14-day period, then you are required to report that to CDPHE and Boulder County Public Health. And I do want to say that just because you do have 2 employees, what our epidemiologists will look at is what has happened in your workplace and points of improvement for hygiene and how you can set up your business to where things could be a little bit better and safer for your employees. So don't be afraid of actually reporting this. This is really important for us to maintain lower numbers and not have as many people infected with COVID. So this is here. We will always take like an education first approach and work with you to make sure that you're protecting your employees and the public as much as you possibly can. So once we receive those reports of 2 cases within 14 days, we will work with you to determine what actions are needed in your particular establishment. And we do have a form. CDPHE does have an outbreak report form here that you can click on. I will go ahead and do that really quickly. So this is the CDPHE outbreak report form, and it walks you through as a business what you should do if somebody's confirmed or suspected. And a lot of times, especially when when we don't necessarily have access to testing, so the procedures for suspected are pretty similar to confirmed. So this guidance here will, you'll fill this out and basically tell them about the situation, and then we'll investigate it. So there are some additional resources. I know that getting PPE is challenging still. So there's Energize Colorado, which is a marketplace that has been established to purchase PPE and disinfectants. There's also a resource on our webpage that I can show you. But the Chamber of Commerce is a wealth of knowledge. I mean, Corinne, she's been sitting in on these webinars for the past 5-6 weeks, and she's probably just as knowledgeable as any of us on all of these topics. So they're a huge resource for you. Also, if you have particular industry associations that would be useful. I had mentioned earlier about farmers markets. I know that there's the Colorado Farmers Markets Associations that have provided pretty good guidelines for how to set up a farmers market. If you are a particular retailer in a very specialized industry, you might have your own industry association. And again, cities. I wanted to reiterate that cities are responsible for the right-of-way. So as you consider how to set up an outdoor retail establishment, or if that's even the course of action you want to take, that is the city's responsibility. And then the county, we really focus on that public health aspect of it. Another thing that I want to say is that we have been on Thursdays, our retail sessions have been on Thursdays for quite a while, but we're switching to Tuesdays. And I know Corinne had mentioned this earlier. Part of it is because there's not a lot of updates that are happening in the retail industry, and you all just haven't had a lot of questions for us. So we are being combined with personal services and limited healthcare and retail. A lot of that is because some of the personal services have both the retail side of things and the personal services side of things. So there was some natural synergies in combining those two. But we will be hosting these on Tuesdays at 3 p.m. And then we will have general sessions where we might take a deeper dive into some of the cross-industry issues that we're seeing. But as always, the Chamber has these videos or has these webinars on their website, and you can register for those. And then here is our contact information, the covidbiz@bouldercounty.org. And then this is also the same team that responds to some of the complaints that we get from the public. So just so you know, we have a COVID violations email that we also receive as a team, and then we will log those complaints and then call businesses if they're having issues or if the public is continually complaining about particular issues. And we will take an education approach first and then more of a stricter compliance effort. But that's all I have. If you all have comments or questions on what we should address next week when we're combined with the personal services and the limited healthcare, please put those in the chat box. We want this to be as useful as possible for you. And we don't know what to address if you all don't let us know what your questions are.
Thank you. We will also be sending out a brief survey with this week's email that has kind of a what do you want us to address in future. So, so I have a couple questions that have come in, and I had one come in via email. So the question via email, I think Jesse or Angel, if you want to talk about this, put on your prediction hats. There were no updates to retail with the latest order that came out this week, and that order expires June 30th. When do you see loosening of retail requirements in the future? Is there a prediction on that, or how long are we going to be in the current state that we're in?
So,
Angel, do you want to take it or do you want me to?
I can take that, it's fine. So I don't think any of us really know what's to come. And I want everybody to keep in mind that retail has had looser requirements than in many other sectors. For example, the personal services, so the barbers and the beauticians they've only been able to have 10 people in their establishment regardless of their space. So it has been a little bit more lenient for retailers where you could have 50% as long as you were able to maintain 6 foot. A lot of it depends on the virus, right? The virus takes usually, and we're going to be slow and measured in our changes that we make, because public health needs to see the implications, the results of any particular changes that we make. So I know that Zach has talked about this quite a bit in previous webinars, but usually whenever there's major changes, it takes about a week for the businesses to adjust and implement those changes, and then 2 weeks for them to be open and operating before we really even see the public health impacts and how many new cases of COVID we have. So I do think that it will probably be some form of the current public health order for quite a while. And I do think that we will adapt and we will be able to deliver services in a new, safer way, you know, like by doing curbside and more delivery. But we really can't predict like the future, and the mask orders are helping us keep our numbers lower. So I don't know if you have anything to add, Jesse.
Nope, that was perfect.
Well, and I just want to add that there are certain industries that aren't even open yet still. So we have
malls.
some of these malls.
Yeah, for example, like malls, they're not able to open because they don't open up from, like, only retail establishments that have doors that open outside can be open at this point. So, I mean, that is one important thing to think about in the retail industry.
And gyms will be opening in a limited capacity this week. Estheticians still can't operate. You know, there's still some industries that still haven't, you know, they haven't been able to, events, for example, to open up. So we have some time. This order ends June 30th, but that doesn't mean it ends. It probably means there's going to be another revision to it, as we always say. So we just need to be prepared. I think we have a question about health checks or temperature and symptom checks. Please talk about if those are still required for employees and how long we'll probably be doing that.
So they are still required, and Jesse, I don't know if you probably have a little more experience talking about this than I do, but your employees can do self-checks and then report that to your like COVID coordinator. So all businesses are supposed to have a person who kind of coordinates their COVID policies and their procedures. I'm sure that there's somebody in your business who's been doing it. It's probably you, since you're here on this call. But there are requirements in the general office on how to conduct those symptom screenings. And we had talked about taking temperatures with the infrared thermometers and then logging those. If people are over 100.4, then they should be sent home. If they are doing their self-check and emailing in those, like their symptom screenings, then you would just tell them to stay home. And they also have a list of symptoms that CDPHE on their screener will collect for, and they also have some forms that you can use.
And I send out, you know, I've sent those out, but Jesse, could you go in a little bit more detail about, you know, maybe self-check, some of the limitations on thermometers?
Yeah, I mean, I think self-check is a great option for a lot of people, but one thing that I would definitely recommend, if you're using infrared thermometers, do not self-check yourself. It's very hard to get the infrared thermometer to read when you're pointing it at your own forehead. It also, the other nice thing about self-check, doing it from home, is a great way to avoid a thing that we've heard a lot of comments about, and I think probably comes up quite a bit with retail, and that is if you're coming in from outside and it's a day like today, or as they've been getting hotter, your temperature is going to be higher coming in from outside. And so giving people a chance to cool off a little bit, get them down to their normal body temperature before you take the temperature. It's a lot easier if they're doing that from home. I think that's about it in terms of adding on to what you both said.
So currently, you're still required, all employees are still required to get a temperature and look at the symptoms. And then if they're doing a self-check, they need to submit those prior to starting their shift.
prior to.
If you're doing it on site, then you probably want your coordinator to be taking those temperatures and logging those in a private, secure, one person only looking at document, but they're still required for retail.
Yeah, and sort of to readdress the question about how long, I think temperature checks will be around in some form or another as long as we have public health orders regarding COVID-19. It's a very simple and pretty good diagnostic way to test if someone has a fever. So it's going to be around.
So even when we get into flu season, if you're sick, don't come in. And some of the ways to check if you're sick are to do these symptom checks and the temperature checks.
Yeah.
And that temperature again is 100.4.
Yes.
That's the level. We had somebody on a previous webinar say a much higher number, but it's 100.4.
Yes.
Is there a minimum complaint number before a business is contacted? So, a certain number of employees.
Sorry, I was shaking my head. That's not helpful. It is not. There is no minimum number. When someone calls in or when we get an email, it goes into a log and we reach out to the business as quickly as possible. Some days we get a lot of calls. It takes us a couple days to catch up. Not all of our team is full-time on COVID-19 response. So it sometimes takes us a day or two to catch up with the comments and the questions, but we do respond immediately. And that's why we consider it education first. If someone calls in about your business and says, I saw X, Y, or Z, we're not going to send you a letter saying that you're in trouble. What we're going to do is call and say, we got a complaint. This is what the complaint was. Can you talk about what you're doing? Here's the checklist, providing you with materials so that you have a chance to figure out how best to meet the requirements in your business. We don't know how your business operates. We don't presume to tell you how. We just are trying to help you meet the requirements set forward by the state. And that's why we start with education.
And I've heard of some complaints coming in as anonymous to the business, and it's actually to your guys' benefit and for the benefit of the economy for those retailers or restaurants or personal services to be contacted and make sure that they understand the requirements. It's to everybody's benefit.
Yeah.
We have a question. We're going to go back to the temperature checks. Must the employer keep the results of the temperature checks and the symptom log, or just confirm with the employee that it's low enough?
You're going to want to keep it. And that's for a couple reasons. One, it allows you to keep a record, but if an outbreak were to happen or someone were to get sick, that record over time helps the epidemiological team better understand any changes in the populations, in the temperatures of the population. And so keeping those records, keeping those emails for people who are doing symptom checks at home is vital.
And one of the tools that we send out is a symptom tracker, just example.
Yeah.
We've heard of companies doing Google Docs, but only having one person have access to that, where they keep track of the symptom tracker every day. But you want to keep record of it. All right, so a question about gloves. Gloves are being recommended to be used by employees when interacting with clients. Finding the food service or nitrile gloves are very difficult still. What are the positives and negatives about the use of cotton or polyester, aka gardening or task gloves?
So, I don't know if I'm not sure if I know the difference or the question on that. I know that even if you are using the latex gloves, you still have to be really careful that you're not touching your face with the gloves on. So it's just more of a reminder for people to not touch their face and not expose themselves. But I can't necessarily speak to the other types. Jesse?
Well, in glove usage, if you're using the disposable ones, you can get rid of them, wash your hands, and put on a new, just to prevent from cross-contamination. But you'd have to probably have a lot of versions of the gardening gloves to prevent that and continually wash them.
I would think sort of like, I'm not sure how good everyone was about it at first, but at the very beginning of all this, when masks started becoming a thing, people said you had to wash masks between each use. And that would be true of gloves as well, especially if you're touching a lot of things. So I would think disposable gloves are the gold standard. If you are using cotton gloves or gardening gloves to stop yourself from touching your face, as Angel suggested, that's not a terrible choice, but I guess I would say we don't have any guidance on that. So I will ask. I can ask our epidemiologists. We can dig into our team here and see what we get back, but we don't have an answer right now.
So in one of the previous ones, they talked a little bit about the rubber gloves for cleaning. So having a set of rubber gloves set aside for anytime you do cleaning, and those can be washed. And then somebody else brought up that sometimes the gloves could be like there's other kinds of gloves like the sandwich gloves and some of those that may be easier to find right now than the nitrile food service, some of those other gloves.
Yeah.
All right, do we have any more questions out there?
I do have one comment on capacity, just because we have a couple new people who are attending these. Keeping in mind that 50% capacity involves the employees and the customers, right? So if you have a small shop and your limit is 7 people, you have to take into account how many employees you have in there. So you might also want to rotate different types of functions to the off hours when employees aren't in the shop. So for example, if you have somebody stocking the shelves or like replacing merchandise, that might be, depending on what your capacity is as a facility, you might want to do those in after hours, like after the store is closed. So that total capacity is employees and public.
So are there recommendations in retail to do what some of the other industries are recommended to do, which is shifting similar people together consistently? So you have the same people working, like they've recommended in like manufacturing and in restaurants, so that you limit the exposure among the employees, or is that?
I haven't seen that. I mean, I know that like the childcare, like that guidance also is to keep, the same teacher with the same group of kids. I mean, it would make sense if you could do that. And if that's a preferred practice, it would make it easier if you do have those outbreaks, to do that contact tracing when you talk to the epidemiologist. But there hasn't been any specific guidance that I've seen on retail.
And just because we use some terms that some people may not know, but right of way means extension of your business into sidewalks, alleys, parking spaces, and streets. And it's some of the things that you're hearing in some of the cities throughout the county and throughout the state offering for restaurants and retailers.
Yeah. And that right of way really is regulated a little bit differently. I mean, even from like an accessibility standpoint, right, from Americans with Disability Act, right? So there's other considerations when something's in the right of way that's not actually in your store.
So this next question, I can supplement it as well, but is there any talk of Boulder County Public Health awarding or acknowledging retailers who are adhering really well to requirements? Sort of a badge system that we could use to market our business.
I don't know. I haven't heard of anything like that, but that's a great idea. I know last week I did talk a little bit about selling your own accomplishments on social media, right? Like showing people like how well you are doing social distancing. But Corinne, you said that the chamber might have.
Yeah, so we, from the very beginning, one of the signs that's in that best practices list of signs is a sign that says "We are open." This was created by all the local chambers, the cities, and Boulder County Public Health. It's your self-verification. It's a "We are open" and we are following the standards. So when you go through that checklist and you check off all of the boxes and you're following them, then you can put that sign out that you're following the guidelines. I know you guys are too busy to go around and inspect every retailer and restaurant and personal service and office. But that's why you created these tools like the checklists to allow you to self-verify that you are doing this and that you can take a picture saying we are open and we're following state and Boulder County standards. So I can find that sign real quick and show people, but just give me a minute. I think because you guys do get a lot of calls that say, can you come inspect our facility? Or if you can find it under your, since you're in there, the signage, under best practices, just general best practices. And then in there is a sign that says, keep going down, open for business, following state and city. Yeah, there you go. So this is the sign. It can be printed in, and we have a Spanish version too. We are following state of Colorado, city of Boulder, and Boulder County Public Health standards for our health and our economy. I think that's the best version of that we came up with it at the time. All right. So, are there any other questions out there? A recording of this video along with the previous recordings, some resources. All of the things that she mentioned are linked to. I know that a lot of the comments I get are, I'm having a hard time navigating sites. Where is that thing she mentioned? And that's why I send the emails out that I do. They kind of just list everything that was mentioned in the resources. So you have it all in one place, but know that you can go to the state site or the county site and be able to find those as well if you don't have my email handy or so forth. At this time, remember that next week we start moving these to Tuesday. We pick the industries that kind of are forward facing with customers that didn't have food service, kind of why that personal services, retail, limited healthcare are together. But continually ask your questions, and as things update, we'll update you. And we hope to see you next week. Thank you to Jesse and Angel for joining us today, and we'll see you guys next week as well.
Thanks, Angel and Corinne. Thank you, everybody.